Let's observe in this anatomical model the 12th cranial nerve. This is a view of the endocranium where we can see the anterior fossa, the middle fossa, and the posterior fossa. At the anterior cranial fossa, we can observe the first cranial nerve, the olfactory nerve. Actually, what we are observing it is the olfactory tract, because the olfactory nerve it is crossing from the nasal cavity into the endocranium through the cribriform plate, and we cannot see it here. To observe the second cranial nerve, we have to observe the anterior clinoid process of the sphenoid. On this region, we can observe the optic chiasma, where the left and right optic cranial nerve cross together. The nerve then is getting into the optic canal, which is below of the anterior clinoid process and reaches the orbit. If we observe now the posterior cranial fossa, we can observe most of the cranial nerves which are related to the brainstem. At the sella turcica, we can observe those cranial nerves which has a role in the movement of the eyeball. The most superior of the cranial nerves is the number 3, the oculomotor. Inferior to this one, we have the number 4, which is the trochlear nerve. Finally, the most inferior, it is the number 6, which is the abducens nerve. To observe the trigeminal nerve, which is the number 5, we have to look at the petrosal region of the temporal bone. At the superior part of the petrous region, we can observe a short but thick nerve, which is the trigeminal nerve, which forms the trigeminal ganglia, and from this ganglia the three main branches depart: the ophthalmic, the maxillary, and the mandibular branches. The facial nerve, which is the 7th cranial nerve, and the vestibulocochlear nerve, which is the number 8, go together through the internal acoustic meatus at the posterior part of the petrosal region of the temporal bone. Inferior to the internal acoustic meatus, we find the jugular foramen, which is the entrance of the internal jugular vein, but also it is the exit point of several cranial nerves. The most anterior nerve that we observe it is the glossopharyngeal nerve, the number 9. Then, the thickest one in the middle, it is the vagus nerve, number 10. Finally, the most posterior one, it is the accessory cranial nerve, which is the number 11. The three of them altogether crosses the endocranium through the jugular foramen. To observe the last cranial nerve, we have to focus on the lateral portion of the occipital bone, where we can find a little nerve which is the cranial nerve number 12, the hypoglossus nerve, which crosses a canal with its own name to exit the endocranium. Let's observe now in this same anatomical model from a lateral view the trajectory of the 12 cranial nerves. One of the easiest to observe it is the optic nerve, which through the optic canal gets into the orbit to get inserted into the eyeball. Now let's have a look to the three cranial nerves which role in the eyeball movement. The first that we can observe it is the oculomotor at the dorsum of the sella turcica, which crosses the superior orbital fissure and it goes lateral to the ophthalmic branch of the trigeminal nerve. Once in the orbit, it divides in two branches, one superior and one inferior, to target the extrinsic muscles of the eye. It also has some branches which go into the ciliary ganglia to target the ciliary muscle and the iris to control the visceral component of the eyeball. We can also observe inferior to the oculomotor nerve a little thin branch which goes through the superior orbital fissure into the superior oblique muscle. This is the number 4, the trochlear nerve. Finally, we can also observe at the most inferior part the abducens nerve, which is the number 6, and this is the one which is going to target the lateral rectus muscle. It is very easy to observe the trigeminal ganglia. Posterior to this ganglia, we find the trigeminal nerve per se. Then, we can observe anteriorly the three branches, which are the ophthalmic nerve, the maxillary nerve, and the mandibular nerve. The ophthalmic nerve crosses the superior orbital fissure into the orbit and is extending into the forehead. The ophthalmic nerve creates three branches: the frontal nerve, the nasociliar nerve, and also the lacrimal nerve. Regarding the maxillary branch, we can observe that it is crossing the endocranium through the rotundum foramen into the pterygopalatine fossa. Once at the pterygopalatine fossa, we can observe how it is crossing the inferior orbital fissure to become the infraorbital nerve. Out of this infraorbital nerve, we have the branches which are going to target the premolar and the anterior teeth. We can also observe the posterior superior alveolar nerve, which departing from the maxillary nerve target the posterior teeth. In this view, you can especially notice the mandibular nerve, which crosses the oval foramen. Once at the infratemporal fossa, the mandibular nerve makes the many branches, such as the temporal-auricular nerve, the buccal nerve which pierces the vaccinator muscle. Posterior to this buccal nerve we have the lingual in a parallel direction, and most posteriorly we have the inferior alveolar nerve. As we can observe in the model, this nerve goes medial to the artery and vein that travels into the mandible through the mandibular foramen. In this model we can also observe the facial nerve, which runs into the petrous region of the temporal bone, forming the internal genu of the nerve surrounding the tympanic chamber and exiting in between the styloid and the mastoid processes through the stylomyostoid foramen. Then it reaches the mandible through the lateral part to target the facial muscles. We can highlight here the coda tympani, which crosses the tympanic chamber to join the lingual nerve. At the anterior and external part of the nasal cavity, that is the nose, we can observe a branch which is the external lateral nasal branch, which comes from the anterior ethmoidal nerve, which is a branch of the ophthalmic nerve. In this image, we can also observe the infratrochlear branch, the supratrochlear branch, and the frontal branches. In this view of the mandible, we can see how the inferior alveolar nerve is targeting the inferior teeth until it gets to the mental foramen, where it makes an external branch, the mental branch, which is going to target the mandible at the external part. Internally, the incisor nerve is going to target the anterior teeth. In the region of the neck, we can observe the hypoglossus nerve, which is the number 12. The glossopharyngeal nerve, which is sending a branch toward of the carotid sinus for assessing the blood pressure. And we can also observe the vagus nerve, which is the number 10, posterior to the internal carotid artery. This vagus nerve makes a branch which goes to target the pharyngeal muscles. In this image, we have a posterior view of the anatomical model, where we can see the last of the cranial nerves. Following the internal carotid artery towards of the common carotid artery, we can find the number 10th cranial nerve, which is the vagus nerve. Next, crossing the external carotid artery in an inferior and lateral direction, and also inferior to the occipital artery, we have the hypoglossus nerve, which is the number 12. In between the occipital artery and the mastoid process, we have the accessory nerve, which is the 11th cranial nerve. The most lateral, which is lateral to the mastoid process, it is the auriculotemporal branch of the mandibular nerve. We can also observe the ninth cranial nerve, the glossopharyngeal nerve. It is observed as a very thin nerve which passes anteriorly to the external carotid artery. One of its branches goes lateral to the vagus nerve and down to the carotid sinus to assess the blood pressure. If we observe the medial view of this model, we still can see several cranial nerves, or at least part of their branches. If we focus on the nasal cavity, we can observe on its anterior portion towards of the nose a branch which is called the anterior ethmoidal branch, which belongs to the ophthalmic nerve. Out of the anterior ethmoidal nerve, there is what we call the nasal external branch towards of the cartilage of the nose, which is the one that we have seen by the lateral view. At the roof of the nasal cavity, we can observe the first cranial nerve, which is the olfactory nerve. It can be seen like a numerous nervous roots going into the cribriform plate of the ethmoid bone. If we look to the posterior part of the nasal cavity, we can see an interesting structure, which happens because we have removed the vertical plate of the palatine bone. Thus, what we are observing it is the pterygopalatine fossa, where we can find the pterygopalatine ganglion, that, as we have explained, it is not part of the maxillary nerve, but some of the branches crosses the ganglia, but without making any synapse. Coming out of the ganglion, we can see the branches of the maxillary nerve which target the nasal conchae, which are called the posterior lateral nasal branches. Within the oral cavity, we can observe the hard palate, which is invaded by the greater palatine nerve, which goes in an anterior direction towards of the incisor fossa, where it crosses into the nasal cavity to make a plexus with the nasopalatine nerve. At the inferior part of the oral cavity, within the floor of the mouth, we can observe the salivary glands, the sublingual gland, and the submandibular. In between both of them, there is a nerve that we have seen before, which is the lingual nerve. Below of the submandibular gland and above of the hyoepiglottic ligament, there is a little nerve coming in, which is the hypoglossus nerve, the number 12.